Hello guys, Jeff from Ethical Practice and Evolve Natural Medicine. Thanks to Massage and Myotherapy Australia, I'm here today to provide you with some tips on creating a successful and ethical practice. So today, we're going to talk about the missing link that is so often forgotten about when it comes to being able to create a successful and sustainable practice. Over a period of time, we start to create a vision of what it is that we want. Then eventually we decide, okay, I need to take some steps to be able to get there. We sit down, we do some planning, we create all these great working documents, those sorts of things. But the problem is we fail to take the action required to achieve the outcome that we want. So it's really important that within your whole business strategy, within your whole practice strategy, that you create an action plan. What is it that I need to do tomorrow to be able to help me get towards the outcome that I have in mind? What do I need to be able to do in the next week to be able to help me to get to that outcome that I have in mind? The next month, the next 3 months. And so within your whole business strategy for your practice, really important to look at an action plan, almost like a list of things that I need to do. Hope this has been helpful. Thanks very much for taking the time to watch this today, and I'll look forward to catching up with you in the next tips, thanks to Massage and Myotherapy Australia.
Hey guys, I hope you can join me next year at National Conference in Adelaide. I've got 2 things that I'm presenting there. A workshop prior to the actual conference on self-care for therapists. Okay, so this, look, it doesn't get any more important in terms of therapist well-being. Okay, we're going to pick it apart the whole day. There's so much to address. I'm so super enthused about getting you to work as good and as effective as you can. The second day is peripheral nerve entrapments, and that is all about addressing something that goes under the radar, especially for you as therapists. So we're going to be assessing everyone's tension, and we're going to be looking for your own peripheral nerve entrapments. I can't wait to see you there. I hope you can join me.
Hello from Associated Bodywork and Massage Professionals, the leading association for massage therapists in the United States. I'm Leslie Young, and I'm ABMP's International Ambassador. I'm so excited about our new partnership with Massage and Myotherapy Australia. Now, MMA members can join as ABMP Associate members at a deep discount and access more than 200 hours of online continuing education and other member benefits. So for more information, visit abmp.com/MMA. Together, we look forward to supporting you and your career.
Hey folks, welcome to Connect. Today I've got a very special guest from Ireland. We've got Aubrey Gowing. Welcome.
Thank you.
Hey, so what are you doing here in Australia?
Well, I'm going to be teaching a myoskeletal seminar in Melbourne this weekend.
Yep.
And then I'm up to
Is that
Gold
a 1
Coast.
or a 2-day workshop?
It's a 2-day workshop, so we're doing a Saturday, Sunday. It's 16 hours, so we do 8 hours each day.
Okay.
And then we have another weekend in Gold Coast.
Fantastic.
And then going back through Singapore for another weekend, and then back home to Dublin for another seminar.
Fantastic.
All myoskeletals.
And I just happened to be filming in the office here today, filming other people, and Aubrey's walked in with our president. So this is very impromptu, but really worthwhile. I mean, imagine just having these wonderful people just walk, our international guests walk into the office. So we just had to get a quick interview in. So my background and research on you hasn't been great, but I think, is it Eric Dalton?
Yes.
So you want to talk, because a lot of people at home know about Eric Dalton, obviously people worldwide do.
Yeah.
So your work is, how does it all fit in?
I suppose I would have started back in 1989. I would have started off very much in complementary therapies,
Sure.
with things like holistic massage and reflexology and so on. And like most therapists, I think over time you've drifted into the kind of the pain management side of things. Treating particularly chronic pain is one of my main areas of interest, and that drifts into both sports people and the average kind of occupational athlete and so on. And over the years, I mean, I've studied many different modalities. I completed my 43rd qualification back in May, so I continue to study. I see myself very much as a student as well as a practitioner and lecturer. And over the years, as I said, studied a lot of different methodologies, but when I started studying Eric Dalton's work, it was one of the things that was a big game changer for me. It really changed my practice. And one of the things I noticed is that it reduced the treatment time massively.
Okay.
That results that would have taken 4 to 6 sessions, I was seeing in 1 to 2 sessions. And it's integrating a lot of different work. There's a lot of soft tissue work, primarily, but there's a lot more joint work and a lot more neurological work as well, a lot of joint mobilization. This particular seminar that we're going to be doing is one of the key elements where we're looking at pelvic stabilization, the different kind of dysfunctions that can occur in the pelvis and how they're going to cause ascending or descending syndromes, and then how to assess and treat those. So we're going pelvis and lower limb on this particular seminar.
Okay, fantastic. Doing anything with the association as far as webinars or anything like that?
At the moment, the seminar is being approved for I was going to say CPD, CPE points.
Yeah,
yeah.
Continuing education
Continuing
points.
education, yeah. And I suppose wearing my other hat, not as a myoskeletal instructor, but I'm also the president of the Irish Massage Therapists Association, the IMTA. And it's been very interesting talking to the various people here today about
so Aubrey's caught up with Andrew Gallagher, our president, today, which was great, and also Tricia, CEO.
Yeah.
And people might know that I've done a couple of interviews in Canada before, and there's whether it's been yet or afterwards, but there's another CEO from Canada that I've interviewed, and I just think it's great that we're able to make the world a bit smaller as far as associations and industry are concerned, sharing ideas. Yeah. So it's been really great that you've been able to drop in for that.
It's always interesting when you travel and you see the commonality in what therapists face day to day in different jurisdictions, what educators face, and what associations face, the different challenges, but also the commonalities. And it's interesting to see how we can work together going forward. And I suppose making our community a little bit more integrated, that we're sharing knowledge and sharing things like you mentioned about webinars, that in the future looking at some of that as well, creating content on each continent and sharing. Yeah.
So I guess Irish muscles and bones are pretty similar to Australian ones, so
pretty similar.
It's so we're starting off on the same basis, which is a good thing.
Yes.
You've also spoken with ABMP, I think, also in the States. So again, sharing resources.
Another very big, very interesting association in the States. Very big into continuing education, as most associations are, and I think very much going the direction of a lot of webinar, online learning.
Sure.
That it's accessible education that anybody can access. You don't need to be incurring expenses of travel and so on. It can be done from home, but I think it's a way of constantly upping your skills, offering the best possible care to your clients, and just continuing to develop and evolve, because one of the things as educators, as therapists, what we have to remember is even spending a lifetime studying bodywork, you're never going to know it all.
Yep.
There's always going to be more that will improve your practice.
Yeah, it's a good frame of mind to have. I mean, one of the differences, I guess, from where you come from to Australia is distance for people, rural areas. So our Halo online learning platform, just in the last few months, actually, has had a real spike in the number of people completing online modules. So it's a must for an association. You've got to be trying to offer the best possible services out to membership, no matter where they are, whether they're sitting here in Melbourne or somewhere else around Australia for us. So the online aspect is really important, and that's why that relationship, talking about Leslie from ABMP in the States, it was a really important step for us to be able to offer our members something above and beyond what we have here as well. So just trying to open things up as much as possible. So.
And I think as well, with our industry being very haptic, that people tend to focus very much on the touch tools, which are very important, but they're sometimes a little bit scared of the theory, the underpinning knowledge. And where you're saying about completing units, I think that's a really important point, that when it's online learning like that, people can watch lectures over and over again, things that you can't necessarily do in a live classroom.
Yeah, exactly.
Particularly if there's some evaluation at the end. And it's not about just testing knowledge. Did you remember a certain percentage of what was covered in a lecture? You can go back over and over these things until you achieve mastery, that you can just continue to study.
He said the word mastery, and guess what the theme for next year's conference is, folks? It's mastery. So there you go.
You hadn't actually mentioned that.
You slot that one in. I didn't even ask you to mention it, so that's great. Aubrey, we better keep moving.
Yep.
So many thanks for popping in today to talk to the folks on the Connect show.
My pleasure.
And hopefully, are there plans to come back to Australia for more workshops?
Yeah, as of yet, I mean, our first workshop is this weekend.
Yeah.
There seems to be an awful lot of interest, so it's likely that we'll be back in 2020, and we'll keep you posted.
Fantastic. Thanks again. See you guys next time.
My name is Laurie Green. I'm the Executive Director of the Massage Therapist Association of Saskatchewan. We are the only association in Saskatchewan that deals only with massage therapists. We are also the largest association in Saskatchewan that adhere to the standards of regulated professionals in Canada and the National Interjurisdictional Competencies and Performance Indicators. Well, the actual association of MTAS has been associated since 1995. However, it came about by the amalgamation of 3 massage therapists associations in Saskatchewan who saw the need to get criteria and standards going, and of course, at the time, working towards legislation. And we are still there today. I think the main values and services that MTAS offers our members is we deal solely with Saskatchewan-based massage therapists, but at the same time have a strong alliance to the national groups, particularly those that are legislated and non-legislated. We have an interprovincial alliance called the Canadian Massage Therapy Alliance. We are dedicated to competency and raising the bar and profession of massage therapists, as well as knowledge transfers through research. We are beginning to delve deeply into research and working with the University of Saskatchewan, for example, on breast oncology and other services. MTAS has been involved since its inception in 1995 of lobbying our government for legislation and regulation in the province of massage therapy. This we do on behalf of the public, primarily, as there is risk of harm, contrary to what many people believe, with the modalities of massage. We want to protect the public. We think the public is entitled to know and feel comfortable that the massage therapist they're using is actually a trained individual. We want the medical, we integrate very well with medical and other health professionals, and you'll see massage therapists often in chiropractic offices or being now referred more through physicians for treatments such as cancer, headaches, lower back pain, etc. And so to us it's very important to raise that bar of the profession and protect the public by doing so. The criteria to join our association is, first and foremost, you have to complete successfully a minimum 2-year, 2,200-hour course in massage. From there, you then have to qualify for what we call our MQE, or Membership Qualifying Exam. This is a psychometric exam, both an oral and a practical exam, which ensures that you meet the basic competency of massage therapist, or in other words, that you have proven yourself to be safe working on your own on a one-on-one with a patient. We also make sure that you have no criminal record that would interfere with going down this career path. And then once a member, you are tied to our Code of Ethics, Standards of Practice, and of course, continuing education, which we require all of our members throughout their career to obtain. So as MTAS moves into the future, as with any profession, we continue to provide services and workshops, education for our members. With that, we have introduced a few lecture series. We call them the brown bag lunches, which we often bring in people to talk for an hour while the massage therapists eat their lunch, and hopefully the provider might bring us a lunch. On business practice mainly, we have done everything from covering personal taxes, work taxes. We work with wellness and nutritionists come in as how that can affect jobs, insurance, disability insurance and how integral this is to your career when you're a sole proprietor often. We also, as I mentioned earlier, with research, we realized just the term research can be a very intimidating subject. So we have done things like journal clubs to help our members understand how to read research and then how that transfers into everyday work. So we have we've had journal clubs and we've had seminars and research committees. The other two areas we've worked on is just dipping our feet in the water of professional practice groups, which we hope to continue with First Nations, healthcare, or cultural diversity that we're seeing much more of in Saskatchewan, and of course oncology. So as MTAS moves forward into the future, we are optimistically awaiting legislation, and every indicator is looking much more hopeful than it has before. With the transition into a legislated province, we are working together with other groups that have members in Saskatchewan, and we will have to change from our two-hat system of being self-governance within our own association and trying to protect the public and the profession. So with that, we're expecting to see a lot of big changes in our association over the next 5 years, and being able to truly focus on the profession and the bar and leave the criteria and the accountability to the public with the College of Massage Therapy in Saskatchewan. We hope that our members will be fully confident by the time the college is in place to move forward confidently and bravely, and know that MTAS will have their backs in support all of the way.
Joining Massage and Myotherapy Australia is easy. Visit the Massage and Myotherapy Australia website, www.massagemyotherapy.com.au. Click Join Now, where you can either join online or download an application form. Your qualification will define which level you join: massage, remedial, or advanced member. Ensure you provide all information requested, including certified copies of your academic transcript, qualification certificate, and statutory declaration. It's important you certify documents and complete the statutory declaration. Documents can be certified by members of certain professions, such as medical practitioners and pharmacists. Also ensure you provide clinic details, first aid certificate, and insurance certificate of currency. If you choose our preferred insurer Aon, you'll be eligible to receive a discount. Once your membership is processed, contact Aon directly via the Massage and Myotherapy Australia website. Once the association receives all required information, your application will be processed. Join now and choose the Association of Professional Therapists.